Hello and welcome to Enhancing Health, the show that brings you health tips for optimum well-being. In today's programme, our focus will be on heart health and how to spot when something might indicate some level of heart disease. The World Health Organization indicates that heart disease is the leading cause of death worldwide. In our studio, we will be having our health professionals who will give their tips on how to maintain a healthy heart and what to do to avoid the pitfalls and the risks associated with heart disease. In the studio again today, we have Dr. Chidi, a lifestyle specialist in lifestyle medicine. Welcome to you, Dr. Chidi.
Thank you. Good to be here.
Great. Now, as usual, let's go to the mailbox so we can see our letter for today.
Jeff is approaching his 60th birthday and is keen to continue working well into his retirement years. However, he has concerns about his current health status. He writes,
I have noticed of late that I get quite out of breath doing even simple chores like gardening. Nowadays, general tasks seem to take more effort, and I find I have to rest in between chores. This has led me to even give up the exercises I was doing, which weren't frequent anyway. I'm often breathless when climbing stairs and on occasions experience tightness in my chest. As I want to work past the 65-year mark, I'm anxious as to whether my health will be up to it. I want to keep working for several more years to come, as I'm behind in my savings plan for a good retirement. My father died of heart disease at age 65, and 3 of his siblings have had various health challenges, including high blood pressure, a mild stroke, and a heart attack. I'm worried that my health is deteriorating, but I'm not ready to retire yet. I would appreciate your advice on what you think I ought to do.
Some real concerns there. Jeff has a right to be anxious. What do you think is the first thing that he should be doing?
Well, Jeff, as with many other people, if you have any signs of chest pain, the first thing you should do is treat it as an emergency and go to your A&E. Seeing your GP is a secondary course, but really it's an emergency. Sometimes when people are having even mild chest pain, what they really are having is a heart attack.
Mm-hmm. Now, in my introduction, I alluded to the fact that the World Health Organization has indicated that heart disease is the leading cause of death worldwide. What is heart disease?
Well, the facts are there, and actually just about 50% of people who die early die from heart disease. So it's more prevalent than cancer, diabetes, all of those other illnesses. Heart disease really is where your arteries, and your arteries are those vessels which are taking blood from your heart to your organs. When those arteries start to get furred up, we say furred up, but it's actually clogged up with cholesterol and fat. And why should they do that? Well, there are 2 big factors. Lots of cholesterol and fat and sugar in the diet, and having high blood pressure.
And these are common things that we're seeing today, which is on the increase. Now, in the letter, Jeff's, we know that he's approaching 60. His father died of heart disease at 65. Should he really be worried? Because I'm thinking that, yes, 65, that sort of age group, but with heart disease and particularly a heart attack, can that happen at a much younger age, especially now you were talking about the increase in hypertension and cardiovascular disease?
So some of the risk factors for heart disease are age. It increases with age, but still, I've seen young people in their 30s and even in their 40s have a heart attack. I always remember seeing a young gentleman in A&E. He was a young, fit-looking guy, quite slender, and right in front of me he had a heart attack, and we had to really work on him to bring him back. So it can be at any age, and especially nowadays, it's increasingly at younger ages. And it's at younger ages because we do less exercise these days, highly stressed, and our diets are actually getting worse. More fat, more sugar, more salt, all of these things are raising our blood pressure and giving indications in your arteries where fat and cholesterol can attach themselves and start to to clog the arteries.
And of course, with a more sedentary lifestyle, just sitting there with all of that happening in your body is a disaster waiting to happen, I would imagine.
Absolutely.
Now, are there any other risk factors, for example, some types of individuals or groups who may be more predisposed to getting heart disease or heart attack?
Yes, well, when we think about heart disease increasing with certain diseases like high blood pressure, for example, all the risk factors for high blood pressure are similarly for heart disease. So some of the risk factors include, yes, we've mentioned sedentary lifestyle, family history. We say family history, someone in your immediate family who's had a heart attack or any kind of cardiovascular event. We don't say that because it's genetic. We say that because the same lifestyles run in families.
That's right.
Okay. There is also something quite interesting that Afro-Caribbean people, especially in this country, have a higher risk of heart disease. And people will ask, well, why should that be? Are they cursed or something like that? Well, it's not a curse. It's just a factor in that we come from hot countries. We are designed then to retain more water because otherwise we'd sweat ourselves to death in those hot countries. In order to retain that water, we retain salt. And by retaining salt, that means we are more sensitive to blood pressure issues because the more salt we retain, the higher your blood pressure will be. So what we have to then do is manage the amount of salt in our diet as well as managing the amount of fat in our diet too.
Well, that's a good point, perhaps, for us to go to the kitchen now to see what Angelette has to share with us about healthy foods and how they can help us maintain a healthy heart. Let's go to the kitchen.
Here we have a healthy smoothie to help to protect the heart, and you can see from the purple colour that it's packed full of heart protecting nutrients, and also we know from the walnuts that it's full of essential oils to protect both heart and blood. So we take a medium-sized banana and we peel it. Now the whole idea of using a banana is so that you can have the wonderful texture, and we're slicing up the banana now into coin-shaped pieces so that when you do freeze it, it's much easier to process using the blender. So we chop up the banana and then we place it in a bowl and it goes into the freezer. And we leave it there obviously overnight preferably, but about 4 hours should be sufficient. And then you can actually take the bananas out and they're ready to be processed. Add in the walnuts, and that's half a cup of walnuts, and also add a small amount of coconut milk. This allows you to blend up the walnuts completely. Otherwise, if you put too much milk in, the walnuts won't blend up enough and you're going to have crunchy pieces of walnut in your smoothie. So blend it up thoroughly. And then add in the bananas and the blueberries and a pinch of Himalayan sea salt. This will bring out the flavour. A teaspoon of Manuka honey. It's quite sticky. And then blend all of this up to a smooth consistency, adding in the extra coconut milk as you go along. Lastly, add in the ice cubes. This will really help to make it cold and very ice creamy. And continue to blend until everything is processed. And pour into a glass. You can see all that purple richness. That's going to protect your heart. For a healthy heart, you need lots of nutrients that help to protect not only the heart, but also the blood vessels. You also need the blood to be protected and all that it carries. Even the red blood cells need to be protected. And what you need for that are antioxidants. Antioxidants are the protective nutrient that help to reduce damage to the cell, damage to the blood, damage to the blood vessels. And why I would say that a blueberry smoothie would be really good is because blueberries are rich in the purple pigment, and that purple pigment is a powerful antioxidant that actually goes in the blood and helps to protect the fat that travels in the blood. Now, when you think about fat traveling, just imagine this ball with lots of different pins in it that is just traveling through the blood at quite a high speed, and it needs to get from the blood to the cells. Now, if you have damage to the blood vessels, which is quite normal, especially over time, the wear and tear from, just blood passing through the vessels, you can have a little bit of scarring. And these are the places where fat tends to build up. If the fat isn't healthy, if it's damaged, it tends to get stuck at the entrance from the blood vessel towards the cell. So what you want is really healthy fat. And you only get healthy fat if the fat's protected with nutrients such as vitamin E, lots of different plant nutrients, etc. So in this recipe, we have blueberries, and they're quite a large volume of blueberries, very easy to digest because they've already been blended up. And older individuals can also enjoy it as well. It's a softer fruit, especially for people who may have problems chewing. So it's a very good recipe to maintain a healthy heart.
Some great nutritional advice there. That's a recipe I might be trying very soon. But Dr. Chidi, one thing that stood out there was the salt, the Himalayan salt. Is that a good idea if you've got high blood pressure?
Well, if you have high blood pressure, the current advice is just to try to avoid salt in any form, right? I'm sure it would taste just as nice without the salt.
Good. Now, there were lots of other fantastic ingredients he talks about there. Was there anything that stood out in Angelette's presentation that you could talk a little bit more about in terms of its nutritive benefit to the body?
Well, she explained very well the brilliant antioxidant effects of the blueberries. And as she said, the blueberries, when they're releasing antioxidants, we talk a lot in health about antioxidants. I always ask myself, I wonder if people actually understand what antioxidants do. And what Angelette described was that what they help to do is stabilize the fat. When fat anchors itself in that damaged arteries, sometimes they will oxidize, which makes them slightly more toxic. And they're stuck there, they start to oxidize, it attracts more, and then eventually that big plaque of cholesterol is formed around the arteries. So the less oxidation of fat, the better for the arteries. So blueberries contain loads of antioxidants. In fact, your food, when it's green, red, blue, or whatever, that colour actually is the antioxidant effect. So the more colourful your food, the more antioxidant effects will be on your body when you take it in. But I thought she explained it very well.
Excellent, that was really good. Now, earlier on we talked about risk factors for heart disease. What treatments are available in the correction of heart disease, so to speak?
Well, heart disease, remember we said, was a factor of blood pressure and cholesterol. So things that can reduce your blood pressure and things that can reduce your cholesterol will be used as treatments for heart disease. So, for example, we give people antihypertensive treatments. These are medications that will lower the blood pressure. We also prescribe drugs that will lower the cholesterol level, like simvastatin and other statins. Now, they're never going to be quite as good as lifestyle changes, which we'll be talking a bit about later. But if they fail to work, for example, let's say your coronary arteries, the arteries that are supplying your heart, if they start to fur up, then what one of your doctors, the cardiologist, may do is put a little stent inside that artery and open it up so that it pushes all the fat to the side, really, and enables that coronary artery to stay patent to supply your heart. If that fails, then the common medical treatment is to go to surgery. And surgery means bypassing those coronary arteries. We usually take a vein out of the leg or the arm and bypass that coronary artery. It's a major operation, means cracking open your chest, just about stopping your heart. It's one of the biggest operations that we do for anybody. It has its risks as well, but actually has been shown to be reasonably effective. The problem is if you don't change your lifestyle, you'll come back in a few years with those vessels furred up as well.
So let's talk about that. Lots of information there about the conventional treatment, but is there anything that can be done to actually reverse the disease itself? Is that possible, or is there some cases, in fact, where the heart disease is so far gone that there's nothing you can do?
There is always something you can do, and this is fantastic news. That closing of the artery due to what we call atherosclerosis, basically fat and cholesterol, can be reversed. Now, even today in medical schools, they're still not being taught this, but we know that by changing your lifestyle, starting to eat whole plant foods, eaten whole, that will begin the reversal process. Even more interesting, you know, it usually takes about 2 or 3 weeks to go and see a cardiologist to get an appointment. Within that 2-week period, if a person is really serious about changing their diet and lifestyle, they can start to reverse that clogging of the artery so much that the pain of angina, that chest pain, can start to go by the time they reach their appointment. It is quite miraculous because it works on a principle that just by opening up the artery just by a tiny amount, actually an awful lot of blood is able to reach the heart.
So that's great news, to get moving with exercise and to eat the right thing. Just before we go to the exercise segment, I want you to ask a little bit about ageing. As people age, they are really concerned about their heart and the way they are in terms of their general health and well-being. Is there anything that you can tell us about ageing and heart health and what we should be looking for as we're getting older?
Absolutely. I just want to clarify something about exercise first, because if you have severe heart disease, we don't recommend that you go into any heavy exercise at all. I mean, as much as you can do in terms of walking, that's fine. But if you have already partially occluded arteries and you start trying to exercise, that can potentiate even more damage. So you need to see your doctor first. But one of the things that was brought up in the blueberries recipe is that those antioxidants that are used to actually make your vessels more healthy are actually used also to prevent the bad side effects of aging. You know, our bodies, our cells age as our DNA starts to oxidize. The more antioxidants you have in your system, the less likely that DNA is going to start to make changes, and the less likely you're going to have the aging process more apparent in a person. It helps you look younger, helps you live longer. There is also the other thing. In order to reverse the amount of damage in those arteries, our bodies actually do a good job in repairing the damage in the arteries so that fat doesn't get stuck there. And it does that actually when we're asleep. So the more rest, the more sleep you can get, the more repair you can have of your arteries. That's why they link lack of sleep to heart disease. The more sleep and rest you get, the lower your risk of heart disease. So make sure you get enough rest.
That's a brilliant explanation, because you know, people just take it for granted. I'll get a good night's sleep, but it's actually doing so much internal good, isn't it? Now, before we go to the exercise segment, in Jeff's letter, he was really concerned that he was doing some exercise, but he said he'd park that for a while because he was getting really breathless on exertion. And you've mentioned that even with breathlessness on exertion, if you are experiencing that, you should be halting your exercise. Is that right?
At that point, that's when you seriously need to go and see your doctor and get proper treatment. You will be able to go back to exercise once you've been treated or once your heart disease has been reversed, but you really do have to be careful of any kind of strenuous exercise when you're getting those symptoms. Well, any exercise, what you are actually doing is you're raising your blood pressure slightly, expanding those arteries a little bit, which is that little bit of caution that we put on exercise, especially of heart disease, because any time you're making a contraction or expansion of your arteries to any great degree, it does put your heart at risk. However, the good news is when you are doing exercise and after you're doing exercise, it actually will lower your blood pressure, naturally lower your blood pressure. So it's acting like a natural form of those tablets you take to try and keep your blood pressure low. It does this via many ways. One of the ways it does it also is by making you feel good, by releasing these endorphins that make you relaxed. So therefore your arteries will open up. And as your arteries open up, your blood pressure will actually go down. Whilst you're exercising, you're releasing adrenaline. And for many of the arteries, it actually opens up the arteries even more. So it's almost like taking that GTN spray, but it's natural. Your arteries are opening up, your blood pressure goes down. Another thing that exercise does in the long run, it causes you to make more high-density lipoproteins. High-density lipoproteins, that's the good cholesterol. That's the cholesterol that takes away all the peripheral cholesterol in your arteries, in your heart, in all those dangerous places, takes them back to the liver to be broken down. So the more HDLs, high density lipoproteins you have, the lower your risk and the lower of your risky cholesterol will be in your system. Then there's the question of those core exercises. The core exercises, sometimes they don't seem to be related to heart disease, but they are, because the stronger you are in your core, the more stable you are. And as you're getting older and you're building up that core strength, it means you're going to have less incidences of falls, less incidences of loss of balance, and you're just going to be more mobile.
Great insights there. I'm thinking now a little bit about the gender issues, male and females, as women are getting older. Are there any differences there between the male and female, and how exercise might help their ageing process?
Well, in general, men tend to suffer worse with heart disease and hypertension up until the age where women become menopausal. That estrogen that is being released throughout the woman's life up until menopause actually acts as a protective agent for heart disease and blood pressure. After menopause, men and women have similar risks for heart disease and blood pressure.
That's interesting, because you obviously, when you look at the ageing process, you think everyone should be exercising in the same way. But it's interesting you've mentioned these specific aspects where women need to keep their exercise going post-menopausally. And then finally, I think one question to look at in terms of exercise is there some caution with over-exercising, especially if you actually have heart disease, you may not know it, or if you're recently diagnosed with heart disease? What are the cautions for not doing too much high-impact exercises?
Well, one of the biggest cautions is whether you have heart disease or you're suspected of heart disease is, trying to do this high-intensity training. This is where instead of doing a 30-minute jog, you'll do an intense sprint for 30 minutes and then calm down for 30 minutes, then do another intense sprint. Now that's good in the long run, but actually for those people who have suspected heart disease, or maybe they don't even know they have it, initially when you're doing that burst of exercise, your arteries will kind of close down a little bit. And if they close down, that can actually occlude your artery completely, which can lead to heart attacks. And there are lots of people in society, some very famous people, who have actually got strokes and heart disease just because they did this high intensity workout. I always say, make your exercise as easy as possible. The best thing you can possibly do is walk. It's the most fantastic exercise we have. It doesn't put an awful lot of strain on the body. It gives you enough impact on the ground to actually raise your bone density, which is great for women as well, especially in older age. So walking, I think, is absolutely fantastic. Aerobic exercises are good too, but you know what? Just walking every day does it.
Great advice. Now, one final question. Some people don't like exercises, so they'll go on these crash diets to try and lose weight quickly. Any advice there about crash diets and heart health?
Yeah, I think the clue is in the name, a crash diet. I mean, crash is never a good thing, right? So the problems with crash diets, especially with heart health, is when you're dieting, when you're depriving your body of enough energy, your body will quite rightly say, right, if you're not going to give me enough glucose, I'm going to take energy from your body, which is what we want. So it's going to take it from your fat stores. As it breaks down the fat, though, that fat has to be transported through the arteries. That means you have lots of fatty acids going through your arteries, which means there's an increased risk that some of those fatty acids can get hooked on some of those damaged arteries to actually potentiate heart disease. So people who have diets that go up and down, those yo-yo diets, they're actually at greater risk of heart disease than somebody who is just having a decent, healthy lifestyle change.
Well, some good advice there to end on. That's all we have time for today. Thank you for joining us. As we close, I'd like to leave you with this scripture in 3 John 2, which says, "Beloved, I wish above all things that you may prosper and be in health." Goodbye for now, and may God bless you.